Thank you very much indeed. And can I offer a very, very warm welcome to our annual public meeting. It is a real pleasure to be here and to be welcoming you to join us on what is actually a really important time for ourselves. I'm just going to say a few things in terms of our reflections on the year, and then we will be working through our agenda as you have in the pack. My name is Mary McLean. I'm the chairwoman of the Royal Cornwall Hospital's NHS Trust, and I just do need you to know that this meeting is being recorded and it will be made available for viewing on the Trust website. This annual public meeting is an opportunity to reflect, to recognise our achievements, to acknowledge the challenges and to look ahead. But it's also a chance for our staff, patients, stakeholders and members of the public to ask questions of us as a board of directors. We work on your behalf. Before we begin proper and on the behalf of the board, I would like to thank all of our staff, our volunteers, partners, who provide fantastic care and support to our many local communities. I am genuinely proud to be the chairwoman of this trust. We have been and continue to be on a journey, and this past year staff at all levels have worked incredibly hard to address the areas that the Care Quality Commission had previously identified as requiring improvement. We were a trust in quality special measures, and we are no longer. We've moved, following our latest Cqc inspection in December 2019, we moved from an overall rating of inadequate to one of requires improvement. While in some respects we were a little disappointed not to achieve a rating of good, we recognise the work still to do, and we're determined to provide the best care we can for the people whom we serve. For our brothers, our sisters, our mothers and our children, we are our community and it's a privilege. I want to thank the board and colleagues across the Trust for their work in achieving the culture shift that we knew would be and has been so important in making the improvements we've achieved so far, and for their unwavering commitment to continuing on our journey to provide brilliant care for one and all in Cornwall. Our health and care partners play an integral part in supporting and enabling the changes that we need to make to better meet the needs of our communities now and in the future, as we move towards an integrated health and social care system, which we're really excited about. Today is the second World Patient Safety Day. It was established by the World Health Organization in 2019 and aims to raise the awareness and motivation and action to improve patient safety in care settings across the globe. Here, locally in Cornwall and in RCHT specifically, patient safety is at the forefront of our actions and behaviours. We strive for the very best care for our patients, and in so doing, we do our best to ensure that our care is, above all, safe. This week, we've been having virtual conversations about what we have achieved over the last year in relation to patient safety, but importantly, about what matters to you in relation to patient safety. I'd like to thank those staff who've submitted posters outlining patient safety improvements during this COVID-19 period. Submissions have included the Stay Connected initiative, improvements to the breast care pathway, a paper light initiative, and how we detect pneumonia during this period. In a moment, I'm going to ask Adam Wielden, our Deputy Director of Finance, to take us through a summary of our annual accounts, and Kate Shields, our Chief Executive, to talk about our achievements and challenges in 2019-20. We then want to take the opportunity to thank the people of Cornwall for your generosity, enormous generosity and great support throughout the year, but specifically since the start of the pandemic. I'd like to highlight the work of our incredible RCHT charity, the poster for which you can see behind me, and the brilliant support we've received from so many friends of the Royal Cornwall Hospital, St Michael's and West Cornwall Hospitals. We'll then end the meeting with a forward look at exciting opportunities within Cornwall for transformation of healthcare throughout service change and very big and very exciting bills. Following that, I want to give those of you joining us online through MS Teams Live the opportunity to ask questions and to talk to us about your reflections on the year and the challenges ahead. You are the most important people to us. We're here for you. We're here to serve you, and we need that conversation with you to be sure we're getting it right. Any feedback is so valued by us at any time. So please do ask us your questions throughout the meeting using the question function on the chat. The protocol for how we'll address the questions is given on the second page of your agenda. So thank you again for joining us today. We genuinely feel we've got an exciting lineup of things for you to see and listen to and join in with. Well, I'm going to start the meeting properly by receiving apologies from Ruth Allerton, our Associate Non-Exec Director, from Rich Smith, another of our Associate Non-Exec Directors, and from Sally May, our Director of Finance. And I just want to ask Sian Millard, our Company Secretary, are there any further apologies, Sian?
Thank you, Chair. We have apologies also from Kim O'Keefe, Joint Director of Nursing, Midwifery and AHPs.
Thank you very much, and thank you for those apologies. And I've just noted on my chat function that actually Ruth Allerton is with us rather than apologising. So Ruth, I am sorry about that, and I'm very glad that you're with us. Thank you for being here. So without more ado, can we then move on to item 2, declarations of interest? Do I have any declarations of interest from anyone in relation to today's agenda? Okay, thank you very much. Which brings us to item 3, the minutes of the previous annual public meeting. You have the minutes in front of you, and I would like to request that the board indicate in the usual way within the chat function of whether you can approve these minutes from our meeting last year. So if you wouldn't mind doing that on the chat, and Sian, if you could let me know when you have quorate numbers. Thank you.
Thank you, Chair. We've got a quorate response for approval.
Thank you very much, in which case I will sign those minutes of the meeting. In moving to the next item, as I said just now, I'm going to ask Adam to provide the overview of the Trust's financial position at the end of year 2019-2020. And then I'm going to come to Kate to ask her to cover performance generally. And if I could refer members of the public to the annual report and accounts in your agenda pack, and that goes from page 6 of the PDF pack. I hope you've all been able to access that. So if I could welcome Adam to the meeting, and over to you, Adam, for your presentation, at the end of which I'll come to you, Kate, for yours. So thank you, Adam.
Thank you, Chair. Hello, my name is Adam Wielden. I'm the Trust's Deputy Director of Finance, and I'm here to provide you with an overview of the financial accounts for the year ended 31st of March 2020. Next slide, please. 2019-20 was another very challenging year from a financial perspective. The Trust had a break-even plan for the year, which required delivering £14.5 million of savings. By the year end, we were actually able to exceed our target and deliver a £50,000 surplus. And this is a really positive result for the Trust, given the operational challenges that the Trust faced. As an acute trust, we have 3 statutory financial targets. 1, to have a cumulative break-even position over a 3 or 5 year period. 1, to operate within our available cash, and 1, to operate within a set limit for capital spend. Even though we achieved a small surplus in the year, we have a cumulative deficit of £29.6 million, so we didn't achieve the break-even target on a cumulative basis. We did, however, achieve our targets for capital and cash. Our capital programme continues to increase in size, and this year we invested over £27 million, and I'll touch more on that later in the presentation. Paying non-NHS suppliers on time remains a very important target for the Trust and as a finance team. And during the year, we were able to pay 94% of our non-NHS suppliers on time. That was really crucial, especially during the COVID, as we moved into the COVID period. Finally, I'd just like to say I'm really proud of my team in their work to prepare the financial statements on time during the COVID pandemic. At a very difficult time, my team did a fantastic job in preparing the financial statements, keeping business critical functions running, and meeting all of the deadlines that they were set. So thank you very much to the team. Next slide, please. This slide provides an overview of the Trust's income for the year. As you might expect, we get the majority of our income from NHS Curno, also known as Curno Clinical Commissioning Group. We received £96 million, or about 20% of our income from NHS England, and this relates to services such as chemotherapy drugs, neonatal services, renal dialysis, as well as high-cost drugs and devices. We received about £15 million during the year for training education. And you'll also see that we received £9 million in relation to services provided. Within the health system, we already have a number of shared services in order to try and work as efficiently as possible, and services provided income relates to those services, such as IT, payroll and procurement. Overall, our income was £37 million higher than in 18-19. Next slide, please. Nearly 60% of our income is invested in the most important asset we have, and that's the brilliant team that we have working at RCHT. Of this £286 million of pay spend, about £43 million relates to what we call variable pay. So this covers agency spend, overtime, as well as our Curno bank spend. The supplies value of £117 million relates to items such as drugs, clinical supplies and other services. And sometimes we pay other organisations to supply activity that we're commissioned for, and this is classed as services from other organisations. This was £25 million during the year. The establishment cost that you'll see relates to items such as telecommunications, computer services, printing and stationery, and office equipment. Next slide, please. This slide shows you a different view of our expenditure in the year, this time showing the spend by care groups and departments. Clinical support is the largest care group from an expenditure perspective, although mainly because it has the contracts for the equipment that we use and the drug and blood costs. As you can see, our Trellis-based care groups spend between £35 and £55 million during the year, but the equally important care groups of St Michael's Hospital and West Cornwall Hospital spend about £9 million each year. The classification of other relates to corporate departments. So these departments contribute to patient care in their own way, and supporting the teams out in the hospital. And to give you an idea of the departments under this classification, we have the People and OD team, Governance team, Cornwall IT Services, Strategy and Quality Improvement team, and of course, Finance and Procurement, just to name a few. Next slide, please. As mentioned earlier, the Trust still has an historic deficit, and this is going to take many years to recover, even though we're able to achieve our break-even target in the year. A key part of improving our financial position is how we deliver savings across the Trust and the system. And although we were able to deliver £12 million of savings in 1920, our main challenge is how we deliver savings recurrently, i.e. costs being reduced permanently. This is something that we continue to focus on every single year, but it's increasingly challenging, especially as we're benchmarked very well from acute hospital perspective. As you'll hear later in the meeting today, we've got some really exciting capital projects and infrastructure schemes coming up. Certainly the most exciting that I've seen in my 11 years at the Trust. It's absolutely fantastic for the Trust. However, we still need to manage our main capital programme very carefully to make sure that we're investing really well in medical equipment, estates and IT infrastructure. The Cornwall health system is financially challenged, like many other systems, and although we're working under a short-term financial framework now due to COVID, we will at some point return to the challenges of having significant financial savings and efficiency within the system. Finally, on the slide, we've had £59 million of historic loans converted to public capital very recently. You'll see that this is £16 million more than set out in the financial statements, as the value changed after the accounts were prepared. This is another really good news for the story for the Trust, as our cash payments will be lower than if we would have kept loans. Next slide, please. This slide sets out very briefly some of the ways we invested in 2018-19, including investment in our estate, equipment and infrastructure in the year. This includes assets that some patients will see, such as a very high specification CT scanner, which we'll have coming online very soon, as well as investment in other ways of working, such as e-notes. Next slide, please. So this slide covers the audit of the accounts. A key part of the meeting is to present the financial statements within the annual report. These have been audited by Grant Thornton, and this slide summarises their findings. Due to COVID, on safety grounds, and so to avoid any disruption to any staff in the wards and areas, as a finance team and as a wider team, we didn't carry out any physical inventory checks or checks of our stock. Grant Thornton staff were also unable to verify our inventory balances, and so as a result of this, had to issue a very technical limitation of scope qualification for the accounts. This doesn't mean that the inventory values were wrong. It simply means that the auditors couldn't confirm that they were correct. Another difference from previous audit opinions relates to the valuation of our land and buildings, again linked to COVID. At the time of the audit, there was significant uncertainty over the value of land and buildings going forward, and this resulted in the auditors issuing an emphasis of matter in their opinion. The remaining three issues on the slide are effectively repeated from previous years and relate to our overall financial position, as I've touched on before, as well as how this organisation, as others do, plan on a relatively short-term basis. Overall, the auditors are very complimentary about how we prepared the accounts and how the audit went. Next slide, please. Thank you very much for your time. Hopefully that gives you an overview of the Trust's finances, especially the financial accounts that you'll see as part of the annual report. I'll now pass over to Kate Shields to talk through the performance for 2019-20.
Thank you, Adam. So we're going to show a short video that summarises our performance over 1920, but before we do, as the Chief Exec of the organisation, I'd just like to say a few words. 1920 has been a really good year for everybody who works at Royal Cornwall Hospitals. We've seen continued improvement in just about every measure you can look at across the Trust. It's still challenging in terms of us being as good as we want to be for the people we serve, the people in Cornwall, but we've still got that ambition to be brilliant, brilliant for our loved ones and our relatives who live in Cornwall, and brilliant generally for everybody who we serve across Cornwall, and of course all of our visitors that come to us during the summer months and during school holidays. Our access to care has improved consistently during 1920. And we had much better referral to treatment times with our improvement in our emergency department, meaning that people who were poorly in Cornwall could access care quickly. Our partnerships with our partners around Cornwall meant that the service models that enable people to be looked after in or near their homes are starting to improve, and those teams that provide care around patients are coming together in a way that means that we can see that we are moving towards that goal that we want to be brilliant for our people. There's a clear focus on safety, and over the 12 months in 2019-20, we didn't have any never events. Those events are things that should never happen in a hospital, and we have put an enormous amount of work into our continuous safety and quality improvement. We've had a really good CQC inspection, and what was really fantastic to hear was that the CQC team were blown away by the positivity of our staff. People wanting to show the inspectors the work that they were doing and what that work meant to them on a professional and a personal level. They saw lots of improvement, and they could see a culture emerging at Royal Cornwall Hospitals that was around us being proud to care and having that ambition around being a safe and effective service. This meant that we were rated as requires improvement, and really importantly for everybody, we came out of special measures. And for the county as a whole and for us as a trust, it's important that the way we came out of special measures was commented on by the CQC, we came out quickly, and we came out with confidence, with our staff being really clear that things were improving. That was reflected in our improved staff survey, with happier staff, happier to work here and wanting to be involved in the care that they were providing. So now I'd like to show the video, and we can all share what people have said about their experience of working here.
We would like to say a very big thank you to all of the organisations and individuals who have supported the NHS, our NHS people and patients over the last few months. Unrecognisable was the description of one assessor in a Care Quality Commission report that signalled tangible signs of improvement in so many areas. We know there's still much more to do, but we have proven what can be achieved in a relatively short time and are determined to keep the momentum going to improve, so we become the brilliant hospitals and services our people and population deserve. More than 6,000 people work together across our 3 main sites in Truro, Hale and Penzance, and at locations across Cornwall and the Isles of Scilly. We care for more than 430,000 residents, our families, our friends, as well as many holidaymakers who come to enjoy our beautiful county. We have and continue to work hard to cut down delays to clinical procedures, to strengthen leadership and address concerns in the safety and quality in some aspects of our services. Our release from special measures in April 2020 showed how our performance has improved over the last 2 years, as we work toward our aspiration to provide brilliant care. Of course, we still have more to do and have our key areas for improvement. We have been working hard to make our care safer. This year, we have reduced the incidence of falls, pressure ulcers, and cases of thrombosis or blood clots, to 0 the number of people waiting more than 52 weeks for routine procedures, although this was later impacted by COVID-19. We have improved our response to sepsis and introduced a new electronic observation system to identify early warning signs. We have been listening and learning from patients, families and carers in helping us improve the care we give. More than 3,500 people gave us feedback through our updated Friends and Family test, and on average, more than 90% said they would recommend our hospitals. We are working more closely with community stakeholders, such as Healthwatch and Kerno Maternity Voices Partnership, and want more people to have their say through face-to-face and virtual events. Our communities want to know they will get safe care whenever they need it. Closer working than ever with our health and care partners has meant people have been seen more quickly in our emergency department, spent less time in hospitals, and been less likely to have their operation cancelled at short notice. We have improved survival rates for people after a stroke. For the coming year, we are working on plans in partnership with other providers to improve cardiology services and, at West Cornwall Hospital, the expansion of day case treatments. We have been changing the way our outpatient services meet patient needs, particularly for those needing routine follow-up appointments. Supported by technology, more people are being monitored remotely so that they and their specialists can identify when a clinic appointment is needed. And many more of those appointments will happen virtually, using secure video conferencing, reducing time and travel for patients and clinicians, as well as helping us become a greener organisation. As well as providing brilliant care, we want to create greener and cleaner hospitals. Our patient environment assessments have shown consistently high standards of cleanliness, and our carbon reduction and energy management scheme is making a big impact on our carbon footprint, hitting our target 2 years early. Alongside our plans to improve services, we will see a massive investment in facilities, starting this year with an expansion of our emergency department in readiness for winter, a 2-year project to provide a new building for our MRI and haematology oncology service, and the development of a business case for a new women's and children's unit. Brilliant care comes from brilliant people. Brilliant people need an open and supportive culture, with opportunities to grow and develop their skills. Our leadership program has reached more than 1,000 colleagues, and we are listening, learning, and changing. The relaunch of our values, underpinned by our commitments to one another, are changing our culture and improving our staff survey results. Our values are the basis for our annual awards, and our first ever Brilliant Youth Festival gave us a fun and inclusive way to celebrate and recognise achievement. Respecting each other is an important part of that cultural change, and we know that we have much more to do. We have begun to improve our support for colleagues, patients, carers, and visitors from minority and ethnic groups. And brilliant people make brilliant improvement happen. Our people are driving the pace of change, with advances in the way we use technology supporting safer care, and a growing portfolio of research, innovation, and development, bringing new and better treatments. Little did we know the 2019 to 20 financial year would end as we started to face a pandemic that would sweep the world, presenting the biggest challenge in over a generation for our health and care services. Now, facing a new normal, we remain alert, prepared, and agile to respond to any second spike in our communities. COVID-19 has changed the way we work, sped up the introduction of technologies that had otherwise been some way off, and brought about a spirit of kindness and generosity from our community. And what next? There's no time to stand still. We have set ourselves 44 milestones to achieve during this current financial year. With many of us working in new ways and a much changed environment, we can take advantage of our progress during 2019 to 20 and continue on our journey to provide brilliant care to one and all.
Thank you. Thank you very much for a really informative set of presentations. If I could thank you, Adam, for a very good presentation, and please pass to your team our thanks. The ability to make the complex look and sound simple is a real skill. And again, Kate, thank you to your team for everything that we're achieving. We should be celebrating this, and we are. So as you've heard, we ended the year with COVID-19, and in our next item, we would like to thank the incredible people of Cornwall for their support and kindness to the Trust during that time and now. So I'd like to move on to the next item and ask Kerry Eldridge, our Director of People and Organisation Development, to introduce this item. Thank you, Kerry.
Thank you, Mary. The team have put together an amazing video of the charity highlights from this year, which we're going to show in just a moment. So I'm going to let our wonderful supporters, volunteers and colleagues do most of the talking and keep this quite brief. I would, however, like to take this opportunity to thank everyone for always so generously giving their time, energy and support. In particular, we are enormously grateful to our volunteers, our staff and our communities during the challenging times that in most people's lives make our patients feel hopefully just a little bit better. As you watch this video, you'll see just a small selection of the truly heartwarming stories we have encountered each and every day, and the real life positive impact that these efforts have had on all of us as individuals and as a hospital community. As you'll see from the video, a range of innovative and fun activities have taken place over the last 12 months, raising a staggering amount of money. As well as improving the lives of our patients, these funds have been used for a variety of of projects to improve our staff well-being during what has been a difficult and uncertain time throughout earlier this year as we've encountered the pandemic. The help of our volunteers who have carried on throughout this time has been invaluable. We'd like to thank them for their incredible support, and now we'd like to share with you our video of thanks.
I want to.
I want to.
I want to.
I want to.
We want to.
Say thank you for your support.
Thank you.
Thank you.
Hi, I'm Kate Shields. I'm the Chief Executive of Royal Cornwall Hospitals. And I just want to say a massive thank you to all of those individuals, companies, businesses that have supported us during COVID. You've been amazing. We are really, really lucky to have you, and we will do everything we can to make sure that we continue to serve you in a way that's right, and that we repay you for all the kindness you've shown us. Thank you.
Royal Cornwall Hospitals Trust Charity have been the beneficiaries of huge levels of generosity during the COVID-19 pandemic. Our local community and supporters are making a difference every day, raising funds and donating to do more for our patients and our hospitals, providing additional equipment, enhancing environments, or giving the extras for our staff, not just during the COVID-19 pandemic, but throughout the year. And we just love how they do it. Taking to the dance floor in RCHT Charity's very own Come Dance With Us.
How lucky can one guy be? I kissed her and she kissed me.
Partying at Truro Cathedral in the very first event of its kind in this iconic Cornish location. Our own trust staff not afraid to get involved and get gunged to raise funds. And of course, our wonderful community raising funds for causes close to their hearts. Kieran walked circuits of his garden.
Kieran, you've raised £4,000. No way. Thank you.
Emily completed a back garden Ironman. Dina set to screen printing rainbows of hope.
As we all know, during the pandemic, our frontline workers put themselves at risk to protect our family, our friends and our loved ones. So it was important for me to help raise money for them. I wanted to do something rather than nothing. So I created the Rainbows of Hope. The Rainbows of Hope all came in editions, and everybody out there who bought one helped me to raise £3,000 for the Royal Cornwall Hospital. So a big thank you and big hugs to you. Thank you.
With all the donations to RCHT Charity, we strive to put the donations to the best possible use for the benefit of our patients, our staff and our volunteers.
So this is Isabel. She's 25 days old. Been a little bit of a monkey and a bit of a fighter so far, but she's doing well. And by the look of it, she's certainly enjoying this. So thank you obviously to everyone for raising the money to come and get it as well.
So our new baby Leos are really good for many, many reasons. Predominantly for families now, they are really, really accessible compared to our old ones. So the old ones used to go up and down as well, which is great for obviously parents' height and if they're sitting. You can now lift I'm just going to lift it up just for a second. Lift this up for easy access for parents and if we're doing procedures. And automatically the heater will come on to make sure the baby stays nice and warm. And also these sides come down as well. So again, when we're doing procedures, we can get really close to the baby, but they're nice and safe and warm in here. If mummies are in a wheelchair and they can't actually get up to stand up near the incubator, it goes as low as right all the way down, and the tray can come out, so baby can come out to mummy, which is also different to what we've currently got. And also you've got easy, sort of really close little doors here that are really quiet, so we're trying to keep the noise down for the baby, things like that they've thought about, which is really easy to use. Talking about sound, it actually tells us up here if it's too noisy in the environment, so Perhaps if there's procedures going on, there's lots of people in the room, it tells us on a guide, so we can actually say, everyone be a bit quieter, because we're trying to mimic the baby still being in the womb. And also alongside that, we also know the lighting as well. So they're kept covered all the time, obviously, unless we need to be looking at what's happening with them. And that probably is it in a nutshell, as in for us, which is much better than what we've been used to. So they are fantastic and we love having them.
Okay, hi, well, meet our lovely new mannequin. So we put forward a presentation to secure some funding so we could purchase our own mannequin. Because it comes in his own suitcase, as you can see here, on wheels, it means that we can do training nights, days, any day of the week, because everyone can have access to the suitcase. So the beauty of this particular mannequin is that it has an airway head, which means that we can practice airway skills such as intubation, RSI, putting in airway adjuncts, bagging, as we demonstrated earlier, but we can also put on monitoring to deliver shocks, so we can be practicing CPR, ALS algorithms, BLS, things like that as well. So this mannequin allows us to practice key ED skills, which are life-saving and need to be delivered in a very timely manner, and are things that sometimes when shifts are particularly busy we don't get opportunity to practice, whereas now that we have this mannequin here on wheels, if we have a small window we can pull him out and go over skills that we might have just delivered in practice, and or if we've had a particular difficult scenarios and we want to do a debrief and we want to run through things in a more controlled, safe environment in which people can ask questions and practice things, then we can also do that with this mannequin too.
Many staff across the Trust have received funding to improve their staff rest areas or to give thanks to their team for their hard work.
Thank you. Thank you to everyone who's kindly donated us vouchers to have a hot drink on site. We really, really appreciate it.
Where would we be without our volunteers? They are the cream on top of the scone, the cherry on top of the cake, and we are so proud that over 40 of them have been supporting us on site during the COVID period, while the remainder have been as supportive from home. We have had volunteers continuing to support patient refreshments in the Headland unit, that's our chemotherapy unit. We've set up the little shop, staffed by volunteers, to provide basic groceries for our staff.
And I'd like to say a big thank you to our honorary chaplains who helped us during the COVID pandemic. Probably the most significant thing they did was to stand at the entrances of the hospital most evenings to welcome night staff coming in and to thank day staff going home, and made a big difference to how staff felt, and we couldn't have done it without them.
I'd just like to say a big thank you to the West Cornwall League of Friends and the West Cornwall volunteers for everything they do for the hospital site. Without them, we wouldn't have a lot of the equipment that we've got currently that the League of Friends have purchased, and the volunteers have been amazing right up until COVID. We're on the ward with their newspaper and food trolley, delivering all kinds of things to the patients on Med 1 and Med 2 and right across the hospital site. So a massive thank you to all of you. We couldn't do what we do without you. Thank you.
In a year of consolidation, the Friends and volunteers have worked together, building on the investment of £18,000 for the remodelling of the outpatients and provision of the new Friends coffee bar. In the last year, the turnover increased to £10,000 and has enabled donations towards physiotherapy equipment and patient communication material. Volunteers continue to support staff in various roles. In June 2019, an innovative and successful partnership with the Royal British Legion planned and organised the annual hospital fete. This reflected the commitment to be a veteran-aware hospital, raising £3,000.
It's a privilege the Friends of the Royal Cornwall Hospital to work as a team with the Trust, and we help in a variety of ways. During the last 12 months, we've donated over £132,000 worth of equipment in places like Delivery Suite, theatres, scanners, amongst many other projects. In mid-March, when the COVID struck us, our fundraising ceased abruptly with the coffee bar having to close. We had limiting collecting boxes and no fundraising opportunities. However, we rose above the problem and continued to provide funding for travelling costs to volunteers who were able to volunteer. We were able to buy picnic tables for consultants to be able to get some fresh air in between shifts, individual radios for patients in critical care, and a water fountain as well. And as a committee, we were concerned about our wonderful volunteers because most of them weren't able to come in because they were either vulnerable or shielding. So we developed a Keeping in Touch weekly newsletter, and every volunteer was also given a personal call from one of our committee members saying, "Hello, how are you?" But we will continue to do all we can to support the Trust and develop new volunteering roles in the new normal.
Everything we do is for our patients, their families, and our staff. But most importantly, at this unique time of COVID, our volunteers have continued to support RCH, and we can't thank them enough.
I'd just like to say another thank you. Thank you to our Royal Cornwall Hospital charity. Thank you to all of our friends at St Michael's Hospital, at West Cornwall Hospital, and also here at the Trelisk site. Thank you also to all of our community members for your incredible support and donations throughout the COVID period, but also at any time of the year. We couldn't do what we do without you. And finally, thank you to our volunteers. You are always there, you are always reliable, and you support both our staff and our patients, and we are eternally grateful. And I'd now like to hand over to Kate.
Thank you. We just felt this now was the right time to share something that one of our members of staff has sent to us, because Rich used to work at, there's a deputy charge nurse at West Cornwall Hospitals. But as we went into our COVID period, the team that works across the wider Cornwall and the Isles of Scilly had to come together in a way that we've never really done before. And he sent me an email a couple of days ago that I just thought was worth sharing. Hi Kate, listening to the news over the last few days and the issues nationally with testing around COVID-19, I wanted us as a trust to give ourselves a really good pat on the back. I have since March moved from my original post to help on the COVID help desk that RCH set up. I can honestly say that RCH is a shining beacon in this period of darkness. Our small team have kept the wheels turning with support and signposting to managers and staff from the ground up, not just supporting staff at RCH, but the whole community trust and GP practices in Cornwall. RCH has not turned one health practitioner away when they needed either swabbing or antibody testing. Everyone has gelled together as one unit, from occupational health to HR, employee support, right through to colleagues in the lab who have worked miracles with one common aim to beat this virus. So even though we might sometimes get this, even sometimes we get things wrong, this time we've got it absolutely bang on right. And I just thought it was nice to share something that somebody sent to me privately, but said that they were very happy to share with at our AGM. So now we move on to transforming care. I think Mary, you want to do an introduction.
Yeah, thank you. Thanks very much, Kate. And in a moment, I'm going to invite the board now formally to receive and adopt the annual report and accounts. But perhaps just before I do, and I think that last quote has doubled it, I don't know about other people, but during that film presentation, I had a tear in my eye, but I also had a big smile on my face, and both things are true. It is amazing to record just how much we all do at our trust for Cornwall and the Isles of Scilly. It's absolutely marvellous. So just before moving to the next item, could I ask the board formally to accept and adopt receive and adopt the annual report and accounts. And if you would indicate in the normal way on the chat, that would be very, very helpful. Thank you, and Sian will count for me. Thank you very much. So thank you so much, Kerry, charity team and friends, for all that work, and again, thank you, Kate, for sharing that quote.
Pleasure.
What we do know is that the awfulness of COVID-19 actually gave us the opportunity also to make significant improvements and changes in the way healthcare is delivered in Cornwall, across the Cornwall and Area Scilly, across the board. As we look to the future, we have a slogan which is no going back. I think it's hashtag no going back, but it's about we aren't going to go back because we can't. The world isn't going to be the same again, and we don't want to go back because we actually want to build on the amazing work, the joined up work that's gone on in our communities. So as we look into the future, we want to maintain that and continue to build on doing things differently. And one of those real opportunities is for us formally to integrate with the Cornwall Foundation Trust for the benefit of the people we serve across the country, the county, because it makes sense to people. People receive care from one place. They don't know that we're different organisations, and you know we really don't need to be. So in a minute, I'm going to ask Kate to come back in and give us the item 6, which is the forward-looking transforming healthcare for Cornwall. Kate, if you would like to take that now, please. Thank you very much.
Thank you, Mary. So we're just going to go into a brief section that goes through how we want to work together with people across Cornwall and the Isles of Scilly to transform how care is provided, and also how we develop those models of care so that we're working together. So this section, I'm going to start off, but then my colleagues Penny Atkinson and Rawlins Murty from General Practice are going to join me to talk about new models of care. And Tamsin Anderson, who's the Interim Joint Medical Director for Cornwall Partnerships Trust, is going to talk us through a tangible new model of care. And then Jane Urban, who's our Head of Midwifery, and John Clark, who is one of our obstetricians and the Clinical Director for Women's and Children's Services, is going to bring to life everything that we're trying to do. So our vision and what we want to achieve for the people of Cornwall and the Isles of Scilly. So we want to achieve brilliant care. And we had a bit of a debate really about whether brilliant care came first or brilliant people, because unless we have a workforce who wants to engage with doing the right thing every single day to set the ambition high for providing really good quality care in Cornwall, we'll never develop what we want to. But we felt it was important to start with the people who are so important to everything that we do, and that's the users of our services and people who care for them as part of their journey of care. Underpinning that is our Brilliant Improvement Programme, and the fact that for us, we were a Special Measures Trust 3 years ago. We're now a trust that's teetering on the edge of being a CQC good rated trust. And underneath all of that is an absolute consistent drive towards wanting to improve, not having to improve. And our Brilliant Improvement Programme has seen a large number of people trained in improvement methodology across Royal Cornwall Hospitals, but also Cornwall Foundation Trust, and working together to make sure that boundaries of organisations don't stop our desire to improve services, and that our staff get to do the right thing by making sure that we work together to achieve the best outcome for all of our patients. So our strategy for 2020 to 2025 set some very ambitious targets for Royal Cornwall Hospital, and with our partners around how we change the face of healthcare delivery across Cornwall and the Isles of Scilly. So we are determined that we'll be population and person centred. And that's easy to say, and it's really hard to do in a county that's 120 miles long and has an island that isn't joined to us, that we need to involve in everything we do around developing the models of care that we want to put in place. People always have different views about how they'd like to access care, and how we develop those models of care means that me, you, us, our families, our relatives, they have to be the people at the centre of everything that we do. We want to be excellent in acute care. We want to be really clear that the thing that we do in Cornwall and at the Isles of Scilly that nobody else does is to provide acute care for our population. So we need to be really good at that. Our surgical services need to be excellent. Access to surgery needs to be good. Our emergency department needs to be amazing. Getting in and out of it needs to be fast with the best possible outcomes for our patients. That will be delivered through clinical improvement and innovation. And one of the things we're not short of in Cornwall is passionate clinicians who really want to make a difference to the way in which care is developed and delivered. They want to bring new models of care into the county. They want to be the first place that new things are offered to our people. And our commitment as an executive team and as a board is to make sure that we can help them to achieve that. One of the things that will achieve that is by the system. I'm starting to not like the word system. I want to call the county. So Cornwall and the Isles of Scilly coming together through a process of integration. And that's not about who's in charge. It's how we work together for the benefit of the people that we serve. And the people that we serve are being really clear about the sorts of models of care that they want to receive. That's our ambition. It's undeniably ambitious, particularly in a post-COVID period, but we are absolutely determined that the coming together that we saw as part of the challenge that was presented to us during COVID is going to be the impetus that will take us forward to change services in a way that meet the needs of people who live in Cornwall and on the Isles of Scilly. I'm now going to invite Penny Atkinson and Rawlins Murty, who are two of our GP colleagues who've been working very closely with us over the last weeks and months, and hopefully for years to come in and to talk to us about their experience of new models of care. And Rawlins is going to go first, and then Penny's going to take over. Thank you.
Thank you, Kate. And I guess I'll take up your offer of no going back. Hello, everyone. I'm Rawlins Murty, GP and PCN Clinical Director from Probus Surgery. For the interest of you who don't really know or understand what PCNs are, the simple answer is PCNs stand for Primary Care Networks, who are a group of GP surgeries within a certain area who have registered an interest to work together as a network and provide clinical services. And we tend to cover anything between 30 to 50,000 patients. And the long-term view of us and NHS England is that PCNs would at some point be the building blocks of integrated care pathways. And as clinicians, GPs and leaders in primary care, one of our biggest stumbling blocks in achieving this is that care is currently quite fragmented where we are. And as service users ourselves, there's been a huge appetite and drive to change that to a more holistic approach so that we're not just treating patients as physical and mental, but as one person. There's loads of different ways of achieving this, and one way is to integrate our pathways and organizations together. Now, this would make us more effective, efficient, and safer in delivering that same care. It would also avoid a lot of duplication, which is important to avoid with our limited financial resources that we have. And in the last few months as GPs, we have been really encouraged and privileged by the approach Kate and her team have taken at RCHT in investing not just their staff, resources, but more importantly, their time in helping primary care, because this COVID crisis has been huge to us. And we really hope that that approach continues. That has resulted in a massive increase in trust and a much better working relationship between primary care and secondary care. Our initial suspicion and skepticism has really turned to a lot of confidence and willingness to work together. As GPs, we want that relationship between primary care and secondary care to grow because our service users, our staff, our patients, they deserve that. Could I invite Penny, my GP colleague, to share her thoughts?
Thank you, Rawlins. So my name's Dr. Penny Atkinson. I'm a GP at Rosedene Surgery in Liskeard, and I'm the clinical director of the East Cornwall PCN. So thank you for inviting me today, and I'd echo everything that Rawlins has said. I think we have this huge opportunity to really shape how health and social care can transform our communities, and COVID has been such a challenging time, but it's absolutely brought opportunities for change that we can't afford to miss. We're committed in primary care to continue the transformation we've seen during COVID, and we've had to adapt really, really quickly and think on our feet in primary care to keep our patients and our communities safe, to safeguard the ventilatory capacity at RCHT and to keep our critical care beds available. And we've really embraced, I think, in primary care, the digital and virtual options, which has meant we can free up really valuable time so that the face-to-face consultations and visits that we do, despite some of the political views that we still do, are on the people that we really need to do them on, and we can spend more time on them and give more quality. So I remember before lockdown, my community patients were waiting 3 weeks to see a GP, and I think the vast majority of practices now are dealing with everything on the day. We're working more efficiently and meeting the needs of the people that need us. As PCNs, we're committed to delivering this vision that we've helped to write, and we've seen that collaborating in recent months with our community teams and our secondary care colleagues to join up care and provide this closer to home is just so important. We've seen groundbreaking work in our care homes, and the people that are so committed to working in those care homes with a real can-do attitude. We've worked closely in the past with our voluntary sector colleagues, but now they're an absolutely integral part and essential part of the future. They bring a real richness to the offer, and I think we really appreciate them more than ever now. We want to focus in primary care on the inequalities we see in health across the county, and we want to ensure that the most vulnerable have a voice, and that we shift our lens towards preventative care and health promotion rather than just trying to fix things once they're broken. And that will only happen with a joined up vision across primary care and secondary care with our council colleagues and social care. And that has to involve investment in the estates so that we can deliver what primary care networks and integrated care areas want to, along with investment in the workforce. So it's a really exciting time to be a GP in Cornwall, and the promise we've made to each other across the system, across the county, is that this is something we have to do and build it on mutual respect and trust. And that has come out of this crisis. And I think what COVID has done is made us all appreciate how fantastic we can all be when we all work together with a shared goal. So thank you very much.
Okay. Can you change the slide? Sorry. Thank you, Rawlins and Penny. And it's clear, you can see by the way that we relate to each other, even virtually, that that compact between people providing care in Cornwall is starting to develop. And once Tamsin and John and Jane have spoken, then I think it's clear that our ambition for our county and the Isles of Scilly are really clear to see. So how are we going to deliver our vision? And these are the key building blocks that need to be put in place. And one of the real things that's really challenging is without one of these building blocks, then the whole of the vision gets difficult to deliver. So we want a new model of care for the people of Cornwall and the Isles of Scilly that's based around what they've been asking for: care in or as near to my home as possible, travelling for the least amount, and being seen by a specialist when that's the best person to see me. So we got so far during the work we did over the COVID period, but one of the things it really showed is that RCHT and Cornwall Foundation Trust working together, the sum of our parts is greater than the individual elements. So coming together and working as one team so that we blur the boundaries between what's RCHT, what's CFT, removing those service boundaries and bringing one workforce together is incredibly powerful. We've delivered the strategic outline case for our integration, which is just it's a good idea, and that is now with our regional colleagues. And the next phase of our integration is working with our primary care network colleagues, with Penny and Rawlins and all of the other clinical directors, around what the operating model for care across Cornwall should look like. We've started talking to people who live in and around Cornwall and the Isles of Scilly around what care should look like, and that will be what will drive our operating model, which will be underpinned in the outline business case that we will deliver later this year or early next year. As part of that, we need to have a digital strategy. Our county is long and thin. We've got the Isles of Scilly. We need to have a way of talking to people, teams coming together that mean that we can be focused on doing the right thing for ourselves, the staff, and also for the people we serve. And during this COVID crisis, the use of digital communication has been immense. This time last year, we would never have thought we could have done an annual general meeting in the way that we're doing it, but that proximity to each other, we're finding ways of doing that digitally. So we're building into everything that we do, how we can see patient records out with organisational boundaries, how I could sit as a doctor in a hospital and read a primary care record, or sit as a GP and see what had happened in a diagnostic procedure in a hospital. And we are very fortunate with Calvin Hipperson, our Director of Digital, that we have somebody who has got the vision, the appetite and the drive to make sure that digital care is embedded in everything that we do. We're accelerating our new care models after what we've learned through COVID-19. And the really important thing for me about this is that this isn't a risk-neutral act. We have to be confident enough to know that the models that we're putting in place are the right thing for people that we serve, and then we just need to do it. So as an organisation, we're making sure we check all the time that our ambitions pointing us in the right direction, our partnerships are strong so that we're working with people who can make this happen with us, and that we're not forgetting that where you live is important in terms of how and where you access care. That then brings us to our new hospital estates programme and making sure that we don't have everything centralised in one place that for some people is really hard to get to. So we're working with our voluntary sector colleagues, with people in and around Cornwall and the Isles of Scilly, to look at how we have access to diagnostic services across the A30 spine, the long road that cuts all the way through the middle of Cornwall. What things can happen outside the Trelisk hospital site? So we're not asking people to travel 60 miles for a daycare procedure that could be done near to where they live. So working with primary care colleagues, we're focusing on Bodmin Hospital, on St Austell Community Hospital, on Campbell and Redruth Hospital, and on West Cornwall Hospital in Penzance, to build together an aggregation of services that mean particularly our older and more vulnerable people don't have to be travelling up and down an A30, which is a motorway, to access care. We're also thinking about how we look after people when they've died, and when their loved ones might be called to either identify their body, or when people want to see their relatives after they've died. And we have one mortuary at the moment at Trelisk Hospital. We're looking at how we can have viewing rooms and bereavement facilities around the county. So probably the most stressful time of relatives' lives, we aren't asking them to queue on the A30 to get into Trelisk. We're making sure we look after them and their loved ones at the times of people's deaths, as well as at the time of people's births. So all of this comes together and it generates a vision, an ambition, an absolute drive for moving our services into the 21st century and making sure that people in Cornwall and the Isles of Scilly aren't left behind in the revolution that's happening around health and care across the rest of the country. I'd like to move us now on to talking about what that means in practice, and Tamsin Anderson, who's the interim medical director. Oh, sorry, there's a video first, and then we'll move into Tamsin. Thank you.
Cornwall and the Isles of Scilly, Britain's most southerly peninsula, unique, beautiful, and so special. But life here has its own challenges, not only in the living and making a living, but in the caring for our population too, providing physical and mental health care in our hospitals and in our communities. The people we serve think of us as just one NHS, even though we are two organisations, Royal Cornwall Hospitals Trust and Cornwall Partnership NHS Foundation Trust. We want to come together in an integrated single trust to provide joined-up mental and physical health care. RCHT provides hospital care in the west of the county and at the acute hospital Trelisk in Truro for serious conditions and procedures. CFT provides mental health care and our community services in our community hospitals, clinics and in patients' homes. Tending hundreds of patients, both in and out of hospital, driving thousands of miles, NHS staff work together to look after our population. Increasingly, though, it isn't only the shared NHS experience and compassion in common. Staff from both trusts are working together in different ways. We want to treat mind and body, the whole person. From when you need emergency services and we're needed to respond quickly to an urgent need, to when you are vulnerable and frightened and maybe need a different sort of caring. To support our newborn babies and their mums and dads right the way through life to live the best healthy lives they can, we want to integrate our two trusts to create one NHS organisation. From our admin staff to our frontline clinicians, we want to put our patients at the centre of all we do. And that could be you or a member of your family. Whatever your needs are, or whatever they might be in the future, we want to be the NHS in Cornwall and the Isles of Scilly, a single NHS organisation where you will be both looked after and supported to look after yourself. The NHS, together in Cornwall and the Isles of Scilly.
Well, I don't know about you, but I really want to be part of that. So with that as the backdrop, Tamsin, could you tell us what it's going to mean practically for people who use our services?
Yeah, thank you very much, Kate, and thank you for the opportunity to talk. I'm Dr. Tamsin Anderson. I'm a GP by background and the Joint Medical Director for Cornwall Foundation Trust, and look after the community hospital wards that were just talked about in that video. And I just wanted to share an example of what could be different for patients and their experience, and actually also for staff in being part of this different model of care. As we talk about moving towards integration as trusts, this isn't just about a corporate reorganisation, but it's absolutely about supporting patients in the most appropriate place and giving those tools and workforce to our communities, as Penny talked about, and what we're able to do when we've got access to those in our local services. And as with all things in this, Kate talked about these passionate clinicians that we've got who we're very fortunate to have working in our services. And whilst we're in the process of going through a formal integration, we're not waiting for that. We've actually just got on and done it. And so what we've delivered through COVID in response to a need to be able to support our older patients outside of an acute hospital setting, but in our community hospitals, where we still have the ability to give hospital level care to patients who don't necessarily need to go to ITU, but might require fluids and antibiotics and treatment for infections, ideally in a quieter environment where we can make sure that people aren't distressed or confused additionally by the care needs that we need to give them when they have an urgent medical need. So I'd just like to share an example of what this means in practice. And this feels a little impersonal when it talks about here, but the GP working in this unit was me. So I can give a real reflection of what it feels like and how it's very different in having access to the things you need as a clinician to be able to do something differently. So these community assessment and treatment units and OPAL units that we've got in the 4 big hospitals across our community settings allow us to admit patients into those directly now from their communities. And because we're doing that, we've got increased medical cover. And on this day, this was me working in this unit supporting the step-up services. But I was actually asked to go and see a lady on the stroke unit who'd fallen out of her bed onto the floor. And that was quite a big drop. And she was very distressed when I attended. The ward staff had called me straight over and the physiotherapist was with her. She was able to assess her movement in the leg. It was short and rotated, which for us clinically is a possible sign of a hip fracture and means that that individual, if we're following our normal pathway, should be transferred immediately to the emergency department for an X-ray. Now, the physio had a look at this leg and said, and the patient obviously, and said there was still reasonable power, and actually, although she was distressed by the fall, actually moving her leg didn't appear to be distressing her too much. As the senior medical person on site, I went and spoke to the X-ray services, which, because we've opened up our on-site acute medical cover in Bodmin, we have the outreach from our X-ray team, which is provided by RCHT colleagues, and they are there alongside us. So I was able to go and talk to the X-ray team, and we agreed that it was in the patient's best interest for us to X-ray her on site. I rang the orthopaedics team to make sure that this was okay, because we were going outside of policy and pathway, and we all agreed that this was the best thing to do. We used a lovely little bit of equipment called a hover jack that lifts the patient from the floor to the bed, like being on a massive hovercraft, and we moved her around on just a corridor ride, rather than a trip around the county in an ambulance for an X-ray, and happily the X-ray didn't show any injury. Now, if we'd followed our normal pathway, that would have been a 999 trip, so we would have had to call an emergency ambulance, potentially away from something else, move that lady, who really was medically quite unwell at this time. She was recovering from a stroke, she was being fed by an NG tube, and we would have had to transport her, which is quite a distressing thing, as you can imagine, down to St Michael's for her X-ray, and then it would have been back again because she didn't have a fracture. Complicating this, we noted as the team were moving the lady that her feeding tube had also been moved, and we were able to re-X-ray that, having correctly sighted it, and ensure that she could continue with her medications and feed. I can't stress enough actually the risk that would have been presented to this poorly lady had she had to be transferred and not had access necessarily to the nutrition and the fluids that she might have needed in order to support her continued recovery. As it was, we were able to rule out a fracture and ensure that her tube was fitted and sighted so that she could continue all of that therapy without any movement from her bedroom, effectively. When I went to tell her that her hip wasn't broken, although this lady couldn't speak because of her dense stroke, she gave me the biggest grin. And as a team, all of us working in that environment felt a huge degree of satisfaction, I think, on recognising that historically that would have been a very different journey for that lady, and for all of us. Actually, we'd have felt upset that we weren't able to offer that service, but as it was, being able to manage that all in a community setting and optimise that lady's care and continue her care on the stroke ward, it just felt a fantastic thing to be a part of, and something that we have a real opportunity to deliver more and more as we integrate our services. So thank you for the opportunity to just tell you that story.
Thank you, Tamsin. So we think the clinical case for us working together formally in a closer way is really well made, because we can offer better care to the people that we're here to serve. But the formal integration of RCHT and CFT has to follow a formal process, and there's a timeline that's in place that will help us to deliver on new models of care. So we're working towards the delivery. It was our strategic outline case has been approved by both boards, and importantly, it's also been approved by our commissioners at Cornwall Clinical Commissioning Group. We've sent that off to our regional regulators, who will be looking at this and getting back to us. So all the strategic outline case says is this is a really good idea, and as you can tell from Rawlins and Penny and Tamsin's description around what a service could look like if we work together more closely, it clearly is a good idea. We're now in the process of developing the full business case, and that's getting together with our staff across all of our services in Cornwall and on the Isles of Scilly, and talking about what an integrated way of working might look like and how the new models of care might emerge from it. We're also talking a lot with our primary care colleagues, both our GPs and other staff working in general practice, and with our voluntary sector colleagues across Cornwall, as well as with people who use our services and their families. Because ultimately the operating model for this new organisation, how it works, needs to be owned by people who will be delivering it. So our vision for the integrated trust of Royal Cornwall Hospital and Cornwall Foundation Trust will be a network of services that spans across Cornwall and the Isles of Scilly, and meets the needs of the people that we serve, with us holding the responsibility for those bedded services, the diagnostic things that need to be in place, and anything for Royal Cornwall hospitals that requires co-location with level 3 critical care, i.e. the intensive care unit at Trelisk. So we're hoping that somewhere between, I don't know, July and October 2021, we'll be given the go-ahead for the two trusts to merge. But all the way along that timeline now is our constant discussions with people who work for us around what good care could look like. And I'm hopeful that we'll get to a point where our services will be integrating faster than our integration timeline can keep up with. We're certainly seeing that when we sit people down and ask them how they want to work together and say it's fine to work across organisational boundaries, that people are grasping the nettle because they've wanted to for a long time, and they're getting on and starting to work together to plan the services that our population so richly deserves. To enable all of that, our estates programme needs to be able to keep up with the work that we're doing across Cornwall and the Isles of Scilly. And we are really fortunate that we've been given some central funding to help us to move our models of care and our services into the 21st century. So our immediate priorities are around our new Women's and Children's Hospital, and John and Jane will talk about that in a bit, so I won't say very much about that at all. The development of MRI and an oncology haematology unit on the Trelisk site. Our MRI scanners are really old, so the fact that we can build new MRI capacity in is brilliant. It's a diagnostic way into a lot of cancer pathways. To have a dedicated oncology ward for people who live in Cornwall and on the Isles of Scilly, so that when you've got a problem, when you are probably at one of the most vulnerable times of your life, you're in a specialist unit surrounded by staff that make you feel safe. And also for me, the test for me around really good cancer services is if I'm taking a chemotherapy drug and my white blood cell count drops and there's a danger that I've got sepsis, can I get into that unit really quickly? And the answer will be yes. There'll be a way to get into the oncology unit so that we can protect people, and also we can give people confidence that when you need us, we'll be there. We're developing new ED resus and rapid assessment and treatment expansion at Trelisk now. And one of the things we've discovered is we're getting really good at doing things very quickly. So the expanded resus will be ready by the 31st of October. And as we move into our traditional busy winter period, we'll also have a resus that's now big enough that we'll have dedicated COVID facilities, so that when people are coming into our ED, we can give confidence to them and to their carers that we will be able to make sure that we look after people in an appropriate way. We've also heard very recently that we're going to be given the funding for a progressive recovery unit, which was part of the Nightingale Hospitals programme. This isn't a Nightingale hospital, it's an adjunct to it. But again, by the 31st of December, we'll have facilities on the Trelisk site, so that we have somewhere, if we do have a second COVID spike, where we can look after people appropriately. If we need to support our care homes because either testing capacity isn't moving quickly enough, or that there's been an outbreak and they need to make sure that we can move people swiftly, the Progressive Recovery Unit will give us the opportunity to do that. So we are all on now making sure that those 4 big capital schemes are delivered. We're then looking to the future, because that does something for mainly for the Trelisk site, but our compact and our promise with our colleagues in Cornwall is care is not about centralised services in Trelisk, it's around those services near to where you live. So we're doing some work with Bodmin Hospital to look at a campus of services so that you can get same day emergency care there, looking at the siting of a CT scanner, and over time hopefully even an MRI unit, working very closely with Cornwall Foundation Trust, with the local GPs, because ultimately this will be a GP-led service with secondary care and community care providing support on the site. We're working with the St Austell GPs around a similar model that isn't as developed yet in terms of what would be there, but in terms of a population mass, it's certainly somewhere that we should be looking to develop services for the future. And of course, we've got Camborne and Redruth Hospital that we are looking at how we could rebuild the Camborne and Redruth Hospital so it meets the needs of a community who, a densely populated community for Cornwall, who need good local access to services. And we have our hospitals at Hale and West Cornwall that we're looking to do infrastructure work to, so that we can do more day case and specialist orthopaedic procedures. So we are planning for a future that gives, I think, a lot of excitement in Cornwall. We will have bells and whistles on the end of it. So we're looking at digital models of care. We're looking at robotic interventions. I still say, and everybody laughs at me, that maybe one day I might not live in the Lizard. Actually, I might move out to the Scilly Isles, and I might have my cardiac surgery on my kitchen table in the Scilly Isles. We need to have some ambition about how we drive virtual and virtual models of intervention. So to bring all of that together and to harness our ambition and to tell us what the future could look like, we're now going to ask Jane Urban, who's our head midwife, and John Clark, who's one of our clinical directors for Women's and Children's, to tell us all about our really exciting Women and Children's Hospital. Over to you, John and Jane.
Okay, thank you, Kate, and thank you everybody, and thank you for the opportunity to speak with you this evening. My name is John Clark. I'm a consultant obstetrician and gynaecologist, and I'm one of the joint clinical directors for the Women and Children's Care Group. And with me, just to my right, is Jane Urban.
Hello, I'm Jane. I'm the head of midwifery, and going to talk about the new bill too.
Okay, so we've gone to one laptop as mine is playing up. So we had our first public engagement meeting recently online, and there'll be many more of those. One of the words that you'll hear a lot is the excitement of this new build. It is a really exciting time, and it's being sort of designed and built and opened in what will be an accelerated time frame, almost unprecedented. Another word that we'll hear a lot is the opportunity around this new hospital. And it's not just about a new building, which we do need, it's about how we will work. So having been involved in some of the early works and working with some of the teams that are involved in this sort of design and architecture, it is just incredible when you compare the building that we're sitting in that will be replaced, which was built decades ago as a building which has got walls and windows and the roof and keeps the weather out, and that's where people go to. An incredible facility that's got so much design elements to it to make it a safe and inviting place for our families, and a good place to work for staff. Now we know that the health as an adult is influenced by your health as a child, or even what happens to you when you're in the womb. So that's part of the opportunity as well, to improve the health and well-being of all of the people of Cornwall. We'll be looking at new and better ways of working, and that does include, of course, digital technology. And we want to be able to offer more choice and person involvement. And I think it's fair to say that we'll have a facility that will be the envy of our colleagues anywhere in the country. Now, there will be lots of changes of how we work in the near future, and that would happen without the new build, and that's where the integration comes in. And we've heard today some things about COVID and how that has affected how we work, and that will be featured in the planning to be able to mitigate or accommodate for future events such as these, should they happen. So that's a very general introduction, and I'll hand over to Jane to say a few words.
So I'm going to use that excitement word. Yes, we're extremely excited about this new build. It's a project that will enable us to transform the way that we provide care for our families in Cornwall and the Isles of Scilly. And it's not lost on John and I that this is a once in a career opportunity, and we're not going to lose any time in creating the exciting plans for this new build. We've outgrown our current facilities. You know, they're old and tired, and we need a new fresh start, and it helps with the planning that we're bringing the teams together, our paediatric teams, our neonatal teams, our maternity teams, and we've already started a lot of that joint working, and it's been really, really good for us to come together, start talking about exciting plans for the new care in Cornwall and the Isles of Scilly, but at the same time building on all our success and our current ways of working. Crucially, we want to include our service users. We want to get local children involved. We want to involve agencies such as Wild Young Parents, Perinatal Mental Health Services, and our Maternity Voices Partnership, and our bereavement charities such as Ella's Memory. These groups have been so important in supporting us through our current challenges, and they will be fully involved in the coming years in developing our new hospital. They're absolutely critical to our plans and to our vision for the new build, and their vision is our vision. We want to build an environment to support the emotional needs and well-being of patients and staff alike. It's so important that we look after our staff, and then our staff will look after our patients. And that building will be based on the feedback that we've received from our families. We want to streamline care. We want one-stop shops. We want to work with the local communities, as we currently do, local GPs. You know, this building will be about all of us and working together. John mentioned about expanding digital technology. You know, this will all be a state-of-the-art building. It's just so exciting. Offering support for young people in their transition from child care to adult services, and right up to the age of 25. You know, we want to build the hospital based around the community, and absolutely crucially is to continue the care out in the community, not bring in the services that we're currently maintaining out in the community. An example is that is the majority of maternity care, for example, is carried out in the community setting, and that will continue. It's very important that we provide care close to the homes of families, and that's particularly important for our most vulnerable. So as you can imagine, we talked about nothing since. It's got us through these really incredibly difficult times, brought us closer together to the groups that do support our maternity and children's services. It's so ambitious. It's an absolutely unique opportunity, and yeah, just can't say how excited we are for the future.
Thank you, Jane. Thank you, John. And what an end to our cantering through what integration and what our ambitions for the future are. So we're in our COVID recovery. Nothing is easy at the moment, but who said change was easy? We've got massive ambition. We ask ourselves all the time, if not now, why not? If not who, then if not us, then who? And we are one team working together for people in Cornwall and the Isles of Scilly. And our determination is that next year at our next AGM, we'll be coming back. We can show you where the children's hospital is coming out of the ground. The new integrated teams will be up and running, and we will be having a whole new way of having an AGM, because it will transcend organisational boundaries. Thank you, Mary. Back to you.
Thank you, Kate. I feel so proud. I have no right to, because this work is all the work of the staff, yourself, and all of the other teams that we work with. But that has been the most inspiring piece of watching and piece of listening that I've done for a long time. And as you know, I do my best not to cry on air, but really it brings a tear to the eye, and it's absolutely fantastic. I'm so excited for everybody, and thank you to all the speakers. If ever there was a demonstration of how we are working together and the absolute value of working together, we've just seen it. Each of the people who has spoken, including yourself, Kate, has genuinely been inspiring, and in particular the patient's story. They are always the best, aren't they? And that piece of work at Tamsin that you did, in a way almost by accident, because it happened to be you, but wow, it showed the way. And similarly, working with our GP colleagues, working with the community, it is so lovely to see the trust and confidence that is building between us all. And it hasn't always been that way. None of us wanted it not to be, but it's so exciting and lovely. And thank you. You should all be proud of yourselves. I'm very, very impressed. Thank you. We've heard so much. We've heard finances, we've heard performance, we've heard charity and friends and future looking, and we really want to hear what our audience thinks. I should note two things. The board has approved the annual accounts and the performance report. We had quoracy on that, so I can report that to you. And I'm very pleased to say that we have had over 50 members of the public joining in today, which for the stalwarts who loyally come to our meetings, they will be as impressed as I am. Thank you so much for joining in. It means a great deal to us. And if you've got any of your friends and family there watching, please say thank you to them too. That brings us to your opportunity to talk to us. I'm going to ask Sian if she will bring the questions to us. If there have not been a great number of questions, don't hesitate to ask now, and Sian will put them to our Chief Executive, Kate. And then, depending upon the time that there is available to us, it may be possible for there to be time for members of the board to make any comments that they would like to. So, Sian, can I ask you to put any questions that you have?
Thank you, Chair. We've had one question from a member of the public, from Rose, and Rose asks, when will restrictions regarding partners attending scans or / being there to support partners in labour for the whole duration of time in hospital be reviewed and amended? Royal Cornwall Hospitals Trust has been very quiet on the matter, where so many other trusts are making changes to better the mental health of their patients and their partners. When will this issue get attention?
Thanks, Rose. So this is a question we've been asked a lot recently, and every week we've got a COVID dashboard that we have for Cornwall, and every week we look at the COVID dashboard, and not just as a hospital but as a Cornwall and Isles of Scilly community. We look at what the data is telling us, and our medical directors and our nurse directors meet as part of a clinical practitioner forum, and they advise us around what we should be doing with our visiting restrictions. Now, we've taken the decision, and it is a really difficult decision, I know it's hard for people to live with, that limiting the footfall onto the Trelisk site particularly, but any hospitals can often become vectors for transmission of infections, is the best way of us limiting the likelihood of any hospital-acquired COVID becoming an issue across Cornwall. The added complication for us around the scan rooms is one of the reasons why we're having to rebuild our Women's and Children's Hospital is the Princess Alexandra wing. The rooms are tiny, they're like little cupboards, and socially distancing a midwife or a stenographer and a mum in the rooms is hard enough, but then when we would add in a dad or a partner, it then becomes really difficult to ensure the safety of mum and baby and a member of staff and partner or friend. So at this point we can't change our visiting restrictions, but what we are looking at is how we provide support for people who might be very anxious during the scanning process. Maybe they've had previous episodes of difficulties while they've been pregnant, or people who receive bad news as part of having a scan. So Kim O'Keefe is making sure that we look after those women and their partners well. And as soon as we can lift the restrictions, we will. We don't want to run our hospital in this way. We find it really hard to ask our staff to put restrictions in place to people at sometimes the most difficult times of their lives. But I just want to reassure you we wouldn't do it if we didn't really think we needed to, and we will continue to make sure we review it on a regular basis.
Thank you, Kate. Thank you very much. Sian, have any further questions been submitted?
No, Chair, no further questions. We've had a couple of comments in, which I'll read. So one from Sherilyn McRory, MP, who said, "You're all doing a brilliant job. You have my full support as well, you know," with a little smiley face. and also from Avril Mumford from the Isles of Scilly Council, who said she just wanted to say she's enjoyed the presentations. So glad to see the Isles of Scilly mentioned, and we'll look forward to seeing the business case for integration. Thank you, Chair. Oh, thanks. Sorry, Chair, I've just seen something else has just popped in. No, that was fine. It was just a comment. Thank you.
Thank you very much, Sian, and thank you to those people who have commented. We really appreciate your support and also your inquiry. And I hope the person who asked the question feels Kate has given a satisfactory answer. So what I'd like to suggest now, board colleagues, is that we have got just under 15 minutes, that if we would like to, everybody has been extremely well behaved and stuck to the programme, but if we would like to, there is an opportunity for any of our board colleagues to comment. And so if you would indicate in the normal way for me with an X on the chat bar, I will invite you to speak. Thank you.
What minutes?
Right, does anybody want to speak? I'll give you a minute to think of anything you want to say. Richard, do you want to speak?
Just really wanted to echo some of the comments that you'd made, Mary. I'm in the, I suppose, the lucky position of not being a member of the board during the year of the report. So in the reflective piece looking back, I just wanted to say how proud I feel on behalf of all of you for the work that's been done and the journey that you've outlined in the annual report, that journey to brilliance. It's been a fantastic achievement. And as I say, I feel I'm in a lucky position to be able to say that without blowing any of my own trumpet, because I wasn't a part of that journey. So that's just something I feel I can pass on. I think it also leads me to, on the basis of the presentations and the case for integration, which I fully support, in getting our organisational boundaries to match the models of care that we want to do is so important. Just wanted to say how privileged I feel to be a part of this board and to be a part of the Trust's work. It's been fantastic to hear the passion and the declaration of trust and confidence that's come across from our partners, and the stories from the charity fundraisers and our volunteers are all part of that extended brilliant family. So just knowing that the clinical leadership that we've heard about and the enabling services is in the right place. So nothing more than a comment of both pride and privilege. Thank you.
Richard, thank you so much for that. I think you are speaking for many of your colleagues, and I can see people saying well said to you there. Sarah Price, you'd like to come in.
Thank you very much indeed, Mary, and thank you to colleagues there in the room who've presented superbly this afternoon, and indeed all those who are remotely presenting. I think my reflection is, having been part of the Trust for a number of years now, is that change is really tough, and it needs real tenacity and an awful lot of passion. And I suppose what I want to say is an enormous thank you to all of our staff, who I think have had both of those things in spades over the last year. And rather like Richard, I feel immensely privileged and proud to be part of it. I also think it's worth saying a big thank you to our patients who have coped with a very difficult and different set of circumstances over the last few months particularly, and I think together we are really making a difference here. So thank you, I suppose, is the message that I want to give.
Thank you, Sarah. That's really lovely to hear. Very lovely. If any executive colleagues would like to join in, you're very welcome. We are a unitary board. Now, I think we may be getting towards the end of a very long week and day. If nobody else wants to speak, I have some final remarks I'd like to make. And I guess that the first is picking up your theme, Sarah Price, which is to thank our Cornwall and Isles of Scilly communities for the support that they have given us. There have been some really difficult asks, as Kate has just referred to, around visiting for the reasons that she's given, but there's been other difficulties that people in the community have been supportive with. And I think a message that I'll take away is we can communicate even better. And so I know Kate has been doing regular sessions on the radio, but we are working out how we can just do better in having those conversations all around our lovely county. So we're going to do that. I'm going to ask Kate, after I've done some thanks, to come in just towards the end there. But I've certainly got some thanks that I would like to make. And there isn't an order of priority here, but it is quite amazing that we have managed to have board meetings in public, in live, online, very good attendance, as I referred to a minute ago, and that has been a huge amount of work on the part of our IT colleagues. So a very big thank you to all of you, including the person who's been helping me today right up to the wire. Thank you very, very much. I think it's right to say thank you to our patients. They've been very supportive to our staff in understanding where we are and what we do, and to our stakeholders, because we can't deliver what we deliver. We're just one part of the system, and I think that we're the acute part of the system, and the whole system works together to make sure we do the very best for Cornwall and Isles of Scilly. So thank you to them. A very, very big thank you to all of our staff. The videos really demonstrate the loving care that is provided. It's absolutely amazing. And just seeing somebody shaving an older man, holding the hand of a lady who looked very frightened, that's what we do. That's what we do best. And, you know, years ago, there was quite a lot of criticism for, you know, nurses seem to have forgotten what they're here for. Well, goodness me. Well, I think we've demonstrated today that nobody's forgotten what we're here for. And a big thank you there. And my last thank you, which you won't appreciate, is to Sian Millard and Lindsay and her team, because this day has been pulled together by them, and they're the backroom people who we don't see much of, but they coordinate, they encourage, they cajole, and they occasionally threaten. But as a result, Pete and Lindsay and other members of that team, but led by you, Sian. So I know you're going to keep out the picture while I say that, but I'm saying it anyway. So thank you. That's been a really, really amazing time. Kate, I'm just going to bring you in, and then I'll say cheerio and wish everybody a good evening. So over to you, Kate.
Thank you, Mary. And I absolutely agree that this is the first AGM that we've had since I've been here. So we're going into my third year. That feels like it's a celebration of who we are, what we do, and really cites us in the community that we serve. And Sian and Lindsay and Pete and Hannah, who are the people who have pulled a lot of this together, I think they've done us proud, to be honest. I just wanted to finish by saying how absolutely, I don't know what the word, honoured seems like the wrong thing to say. I love working here. I love the fact that we are coming together as one team in Cornwall, and that we talk about this thing called system working. Well, I think we're actually doing it. The partnerships that have developed across Cornwall and the Isles of Scilly, the conversations that we've had, I don't know about how many people we can get off the Isles of Scilly in a Chinook helicopter, and how we will support people if we need to. And we've planned for amazingly difficult things. We've worked together to deliver really good services. We haven't always got it right, but the intention to be the best we can for Cornwall is just there. So I just wanted to say I'm really proud of our organisation, and everybody who works in it. I think they've shown themselves up very well this year for Cornwall.
Thank you, Kate. Thank you very much indeed. It's a total privilege to work here, and I'd like to assure the public, I've been here a few years now. I would like to assure the public you genuinely have got a team of people as board members and staff who really, really care, and who are working on everybody's behalf, because we're members of the community too. So I hope you feel that, and I really wish you a very, very good evening, and I think great meetings end just a few minutes before so that people can all relax. And so thank you. We've had an outstanding couple of hours, and you know, we talk about our journey to brilliance. Well, I think it's been brilliant, and we probably ought to have an emoji of a light bulb flashing on and off now, but I can't do clever things like that. So very many thanks. We're really looking forward to you coming to our board meetings in future. Please do. And also it'll be lovely to have our annual public meeting next year to look back on today's presentations and to just note the movement. And who knows, perhaps we'll even have members of the public joining in and making presentations too. So thank you all very much, and I wish you a very good evening, and goodbye for now.